So the World Health Organization plays a pivotal role in shaping global strategies to combat childhood cancer and reduce childcare disparities. It is my great honor to invite Dr. Irshad, the WHO specialist representative in Cyprus, to the podium to deliver his remarks. The floor is yours. Thank you.
Kalimera, I wouldn't mind being any small part of even Dr. Stella, even she was telling me as a European Health Commissioner, so what she has achieved in her tenure and the moonshot parallel program that they have in Europe, astonishing and amazing. And then I was just talking to her and saying that maybe she will have now more time to work with us and support Cyprus and the partnerships that we are having here. But I'll come to my talk. Dr. Giannaki just left. Professor Dr. Kyriakidis, Professor Louizos, Dr. Marilis, distinguished experts, esteemed colleagues and guests. Kalimera and Carlos Sarisma, and top of the morning. It's an honor to welcome you all to this convention dedicated to advancing childhood cancer care and reducing global disparities. Today, we gather in Cyprus with a shared mission to strengthen international collaboration and innovation through partnerships. And I think we all present here are a good attestation of that core partnership and the cohort. To work that every child, regardless of where they are born, as Dr. Kyriakidis also very rightly mentioned, and regardless of where they live, have access to life-saving cancer care. At global level, 400,000 children and adolescents are diagnosed with cancer every year. While mortality rates are declining, there remain significant challenges beneath the surface. Underdiagnosis. Many cases go undetected, especially in low-income countries, because of the capacity, access, coverage, utilization, advocacy, knowledge, awareness. Health inequalities, the reason that we are here today. Access to diagnosis and treatment varies drastically depending upon where you live and in which country you are. Scarcity of data and information. Without accurate information, we can neither develop effective policies nor monitor our progress in the direction we are going. Disparities in prognosis are also profound at global level. In some parts of the world, more than 80% of children with cancer survive, while in others, survival rates drop to a meager 20%. Such a wide chasm in survival rates at global level should be unacceptable, period. In the European region, childhood cancer is the second leading cause of death. Another key challenge is the palliative care, which still remains an emerging concept in many countries, unfortunately. When more countries recognize the need to strengthen childhood cancer care, palliative services must be integrated into health systems to improve not just child survival, but the quality of life for young patients and their families, and as Dr. Kyriakidis also rightly mentioned, the mental health of their caregivers and families. In WHO European region, thanks to the leadership of Dr. Kyriakidis, Dr. Hans Kluge, the regional director of WHO Europe, and many other partners like Elpida Foundation across the region and across the globe, but we also face major health challenges, including an aging population and the increasing burden of non-communicable diseases, which account for 90% of all deaths in the region. Among them, cancer remains a leading cause of mortality, not just among adults, but unfortunately also among children. This convention today marks the beginning of a multi-regional effort that aims to enhance international collaboration in pediatric oncology. The objective is clear: to ensure every child has access to the therapies and the support they need, and their caregivers and families have also access to mental health advocacy and support that they need. Cyprus is uniquely positioned to host this effort. As a nation at the crossroads of Europe, Asia, and Africa, its strategic positioning and its geopolitical importance clearly outweigh its size. Cyprus also has a long-standing and a distinguished history of facilitating international dialogue and cross-border cooperation. Just our support for conflict in the Middle East through Cyprus Maritime Corridor happening as we are sitting here is one of the attestation to the capacity, will, advocacy of the Cypriot leadership. Today's event also reaffirms that unique perspective, bringing together diverse expertise, cultures, and worldviews for a healthier future for all. This powerful idea, the need to reduce inequalities and improve cancer care for all children, is shared by all partners globally, EU, by WHO, European Union, Cyprus, Ministry of Health, the Elpida Foundation, and many other stakeholders. The WHO country office in Cyprus, the newest of all WHO, over 190 country offices across the world, is serving as a catalyst for the realization of inter-regional synergies on one hand, while showcasing the humanitarian stewardship, values, and rich expertise of Cyprus, what it has to offer on the other. Established in January 2023, the WHO country of Cyprus was conceived as the next generation country office model for all the WHO country offices and the future ones. Together with its member state, will not only address intra-border health and well-being, but also strengthen cross-border and inter-regional collaboration for sustainable development and health security. This convention, held under Cypriot patronage, is not just a high-level event, but it also attests to the realization of that far-reaching vision of leadership of Ministry of Health, Cyprus and WHO European region, European Commission, European Union, and partners like Elpida Foundation. Distinguished experts, colleagues, ladies and gentlemen, children, no matter where they live or what their circumstances are our future, and we must safeguard it. In the end, I avail the opportunity to thank Dr. Stella, the Ministry of Health, His Excellency Mr. Damianos, Professor Luizo from Elpida Foundation, my colleague Dr. Maglis from WHO Europe, and all the team for the support to the budding WHO country office. Today's discussion will become tomorrow's actions, hopefully, for the improved prognosis and health outcomes without borders in pediatric oncology. On behalf of Dr. Tadros and our DG and Dr. Hans Kluge, a very, very warm welcome to all of you, and I wish you a very successful convention. And sincere thanks again to Elpida Foundation and Ministry of Health and the other organizers of this event for bringing us together to underscore this critical issue. I will end with what the courage and the ambience that, or aura that the children set, and when they said, there is no choice to make it, let's start giving. What? Working together. Thank you.